everyone, and thank you so much for joining today's special topic webinar, Safe and Supportive Fundraising, presented by Needy Med's partner, Help Hope Live. My name's Carla. I'm the Director of User Engagement at Needy Meds, and before we get started, I'm going to offer a few tips so you can make the most out of the presentation. First of all, you can feel free to type questions into the questions section of your go-to webinar control panel at any point. Just know we will reserve answering questions until the end. If we don't get the chance to answer your particular question, we will follow up with you by email, but we will also, of course, provide the contact information for our organizations. The heads up that today's webinar is being recorded and will be available on our YouTube channel. And you can also find our PowerPoint slide decks and other handouts we thought you'd be interested in that handout section of your go-to webinar control panel. So let's dive in with what is Needy Meds. We are a national nonprofit founded almost 25 years ago, and we are dedicated, as you can see, to educating and empowering those seeking affordable health care. And that's our mission statement. But simply put, Needy Meds connects people to programs that will help them afford their healthcare expenses. And I'm happy to let you know we do that free and anonymously through our toll-free helpline, 1-800-503-6897, and our website, needymeds.org. So what you're looking at is the homepage of our website. And I like to put that up because our site really is the face of our organization. As you can see, it's full of information, so I encourage you to browse the site further when you have time. For now, I'm just going to take a moment to point out a few resources. I mentioned already that today's webinar is being recorded and it will be added to our YouTube channel. You can find a link to that at the top right of the homepage with the rest of the social media icons, which of course we hope you click on and follow us there as well. If you're looking for healthcare cost savings programs, you'll want to begin your search with the aptly named Healthcare Savings tab. The Education tab right next to it, that's where you can sign up for other upcoming webinars. You can subscribe to our monthly newsletter, Vitals, and order brochures and drug discount cards, for example. So, as you saw just a few slides ago, an important part of our mission is educating people. And of course, we define that by educating people about Needy Meds and the resources we offer. But we also fulfill that education portion of our mission by sharing with our users other reputable and reliable resources that will help them in their healthcare journey. And that's why we're so pleased to have our guests, Sunny, Pat, and Diane from Help Hope Live here with us today. So first, let me tell you just a bit about Help Hope Live. They're a national trusted medical fundraising nonprofit based out of Philadelphia, Pennsylvania. Founded almost 40 years ago, Help Hope Live has assisted thousands of individuals of all ages from across the country living with catastrophic medical conditions to fundraise within their communities for their medical expenses and related costs. Providing the support and expertise needed to make their clients successful, Help Hope Live offers a safe and trusted way to fundraise, allowing their clients to live their lives as fully as possible. So now let me tell you a little bit about our guests. First of all, Sunny Mullen is the Help Hope Live Director of Outreach. She is from the Philadelphia area and spent the first part of her career in New York City working in television. She joined Help Hope Live in 2016, first working in the finance department, and now proudly as the Director of Outreach, helping to build the outreach department to bring Help Hope Live's mission to a wider audience. With a personal connection to Help Hope Live's mission, Sunny is happy to use her experiences to connect and speak with individuals in the disability community all over the country with the goal of helping them safely fundraise for their medical and related expenses. I'd also like to welcome Pat McEntee. Pat is a Help Hope Live ambassador, and he is also a 2017 heart transplant recipient and has been fundraising through Help Hope Live as a client since 2015, shortly after he received a heart pump to help keep him alive until his transplant. Thanks to the generosity of so many people, he was able to focus on getting and staying healthy rather than focusing on how to cover medical bills. Pat and his wife Amy live in Dayton, Ohio, and enjoy traveling and enjoying nature. They are forever grateful to Pat's heart donor, Bob, for the gift that has allowed them to continue to enjoy these things and many more. Check out #ThanksBob. Moving on to our other guest, Diane Vitkus, who is also a Help Hope Live ambassador. Diane is a 29-year-old raised in a small town in upstate New York. She grew up very active with her two older sisters. She was a three-sport athlete and went on to play Division I lacrosse at Brown University. She then went straight to Pennsylvania School at Lemoyne College and was working as a surgical PA in Syracuse, New York, when she suffered a C6 spinal cord injury, resulting in complete paralysis, leaving her quadriplegic. Diane then came to the Spalding Rehab Center in Boston. Fundraising with Help Hope Live has allowed her to permanently relocate to Boston to continue working with her specialists and maximize her recovery potential. Diane remains very active and has goals to get back to work as a PA this year. I'm excited to welcome our guests so they can share their expertise and their experiences with us. So, without further ado, I'm going to pass the mic and the screen to Sunny, and hopefully I will do that seamlessly. And as I do that and Sunny grabs the screen, I will remind everybody once again, if you do have questions, feel free to go ahead and submit them by typing them into the questions section of that GoToWebinar control panel. We'll do our best to get to as many as we can. And with that, Sunny, I'm going to go ahead and pass the mic to you. Thank you so much.
Wonderful. Thank you so much, Carla, and thank you for everyone for attending today and wanting to learn more about Help Hope Live and our services. So as Carla said, we are Help Hope Live. We are a national nonprofit that has been around now raising funds and hope since 1983. And I am very happy to be joined today by two of our brand ambassadors, Diane and Pat. And my name is Sunny Mullen. I am the Director of Outreach and happy to be sharing our story with you all today. So at Help Hope Live, our mission is to support community-based fundraising for people with unmet medical and related expenses due to cell and organ transplants, catastrophic injuries, and catastrophic illnesses. And what we do is quite literally in our name. We help ease the financial burden of a medical crisis. We provide hope at a time of overwhelming need. And we support patients to live their lives as fully as possible. And in our history, we have been very lucky and proud to help, as Carla said, thousands, upwards of 20,000 families throughout the years raise over $165 million toward their medical expenses. And we are now assisting more conditions than ever before. We were founded here in Philadelphia by a heart transplant surgeon and his wife looking to help their patients solve their financial need toward their transplants in the early 80s. So we were founded on transplants, assisting that community for the first 20 years of our existence. And then in the early 2000s, we had a local student here in Philadelphia get injured and knew our model and asked if we could open our doors to the injury community. So then we started with the spinal cord and traumatic brain injury community. And now truly so many catastrophic illnesses, including obviously in these last few years of COVID and cancer and so much more. And we are truly now helping any community living with a catastrophic medical condition that is experiencing a financial hardship. We are here to help you fundraise toward your medical expenses. So how do we do that? And what is the advantage of using HelpHopeLive over another fundraising platform you might be a little more familiar with? Our three main advantages are, as you see, our personal support. We set you up with a campaign page on our website and a one-on-one client services coordinator that is here to give you all of their tools and expertise and support to set you up to be as successful as possible in your fundraising efforts. And then we have a full finance team and really our entire staff that is here to continue that support through your entire lifetime. We are here to help you fundraise for as long as you have medical expenses. We are not just a one and done, one fundraiser. We're here for your lifetime. And in that, we are a nonprofit, so all donations being made in your honor are tax deductible to the fullest extent of the law. And your donors might be eligible for some matching gifts. If they work for certain employers that match their donations, they can sometimes double or even triple their donation depending on their employer. And the way that we manage these funds, so all donations that come in your honor are made to HelpHopeLive and held in regionally restricted funds depending on where you live. And then you submit your bills to us and we help pay those bills out of those regionally restricted funds. So these funds that are raised in your honor are never looked at as your assets. They protect your asset-based benefits, and they should never become taxable income to your family. So these three main advantages truly help give your community the trust and reliability in donating toward your fundraising efforts and helping us, as I said, raise over $165 million in almost 40 years. Another thing that really helps us gain the trust of the community is that we medically verify every campaign we work with. We receive over half of our direct referrals from medical professionals all over the country. So in your welcome packet, there will be a very simple one-sheet form that can be filled out by anyone on your care team that it simply verifies the medical need so that your community and anyone looking up your campaign page will know that indeed you do have that medical condition you are set out fundraising for. So just one more advantage in working with HelpHopeLive and another level of trust we provide. And as I mentioned, those custom campaign pages, so these are a really wonderful way to engage your community. Your client coordinator can help you write your story here. You can put up pictures, videos. You can do all your fundraising directly through this page. You can share this on Facebook, post updates. Your community can leave messages. It's really a great gathering place for all of your fundraising efforts. So we make this as easy as possible for you to reach your community. And then, as I said, that client services coordinator is truly here to give you all of their support and expertise. First and foremost, in fundraising. They will start you out with a 3-page document of different types of fundraising ideas. Because we are national, fundraising looks completely different everywhere. We can turn anything you're interested into a fundraiser. And then from there, they can help you with flyers for your fundraiser, with anything you might need related to those fundraising efforts. Media support, social media support. And speaking of, they can help you even reach out to your local media and press, and maybe part of your story will get picked up and help the greater community learn about your situation and maybe donate toward your campaign. So this is something in all of the different ways that our client services coordinators can help really boost your fundraising efforts. So once we've got you fundraising, what are you fundraising for? Truly anything related to your medical condition. We can help you pay toward insurance premiums, hospital bills, travel related to your condition. Maybe you need to temporarily relocate for a surgery or rehab, caregiving expenses, service animals, different types of equipment, home modifications. Truly whatever you might need related to that condition, we can help you fundraise toward it. And if you have a question, maybe you aren't sure if we would cover it, please don't let that deter you. Have the phone call with us. Let us determine if we would cover something or not. Sometimes we might ask for a note of necessity from a physician or a physical therapist to verify the need for a certain item, but we will most likely cover it if we get that note as well. So we are here to help you live your life as fully as possible, whatever that looks like for you, whether that's a new wheelchair or a different type of medicine you might need. We're here to help you do that. And so we make it as easy as possible to get those bills paid. This is our fund request form. You can find this on your campaign page, easily downloadable. And right here, this is where you would fill this out, send this to the fund request email with a scan of your bill. Very easy to just email everything in and help you get that bill paid. We get our bills paid pretty quickly within 5 to 8 business days of receiving all of the complete paperwork. We do offer direct deposit to any of our clients or vendors that might like it to be able to get paid a little quicker. We do prefer to pay directly to vendor when possible so that we don't ask our clients to have to put any funding up front. We're not expecting you to have to pay for any of this if you're not able. That is what the fundraising is for. And so as you see, we've processed over 4,500 fund requests just last year, and I know that we are on our way to exceeding that number this year. So we are busy processing these bills, absolutely. And we have so many resources that we are here to offer you, especially in the last couple of years of being at home and maybe not being able to get out as much. We've found ways to offer different types of resources. One are our fundraising video appeals. All of our clients, within the first month or two of becoming a HelpHopeLive client, will receive a fundraising video appeal free of charge. It's something that we offer with your campaign, and it brings in your pictures and your story and is an ask from our executive director. So this kind of helps with that angst or maybe nervousness of asking your community for help. This is just one way that we can help with that. So this is an ask directly from our executive director. You can share this video and make it very simple for people to start donating. Another thing that we've started doing the last couple of years are our resource directories. We have pretty complete resource directories for all 3 of our categories of transplant, catastrophic injury, and catastrophic illness that really offer a whole slew of resources from all over the country. If we can't answer a question, we will turn to our resource directory and see if one of our resources can help answer that question for you. And another way we've really started helping our clients, which obviously we will get to Pat and Diane, I promise, but our brand ambassadors. We now have a great group of brand ambassadors from all over the country that are HelpHopeLive clients and family members that have been through our process, that sit where you sit, that know the process of going through these medical journeys and can help answer any of your questions firsthand. So these are just some of the resources that we're able to offer to our HelpHopeLive community. Another thing that we're able to offer as well is some partnerships, 2 of which being with pharmacies. Amber Pharmacy is more of a local pharmacy in the Midwest, and we partner with Walgreens, and it's a really easy way to get your medications directly mailed to you, and they direct bill us. So it's just a very simple way of getting your medicine to you without you having to pay up front. Beyond that, we have so many different partnerships with different vendors and different types of organizations that can help you further your education and maybe some of your equipment needs. So with that, I'm going to bring in Diane so that I can shut up. You don't need to hear from me too much longer right now, but I want to bring in Diane to introduce herself and tell her story. Diane?
Hi, my name's Diane. Hi, everyone. Excited to be here. So, as kind of mentioned before, I got injured 2 years ago. It was July of 2020. I was on the roof watching a sunset, and then on the way down, I slipped and fell off the ladder and was paralyzed from my chest down. I was in the ICU in Syracuse, New York for about a month. And during that time, I didn't have much mobility and wasn't able to do much on my own, but my parents, very supportive, and looked up, just basically Googled spinal cord injury resources. They found the Dana and Christopher Reeve Foundation, and with that, they in like the packet that my mom received from the Dana and Christopher Reeve Foundation. She found information about Help Hope Live. And then together, my parents created a campaign page with the Help Hope Live staff. And it just kind of took off. I feel like right when someone's injured is the most important time to, get that fundraising page started, like as quickly as possible. And I'm just so lucky that my parents found Help Hope Live and decided to go with this organization compared to any other one out there. After I kind of got out of the hospital a little bit, I was able to take over some things and do some on my own, and then formed a great relationship with Sunny and the other members of Help Hope Live, and became an ambassador. So I'm just really, really lucky that my parents found them, and I have been trying to just like spread the word and really get the name out there in the Boston area and even in the Syracuse area, because I want other people to have this opportunity like I have. So kind of my
Awesome.
story.
Thank you so much. Yeah. And also want to bring in Pat, if you could tell your story to the group.
All right. Hi, everybody. My name is Pat McEntee, and as mentioned before, I received a heart transplant in 2017. Like Diane mentioned, as soon as you know you're going to need this help with finances, with her was an injury. With me, it was knowing that I needed a heart transplant, which, at the time I was listed in 2014, I really didn't know about Help Hope Live. It wasn't until about 6 months later that I was, it was almost an offhand comment by my social worker at the Cleveland Clinic. But she mentioned that Help Hope Live and then another organization that basically would do fundraising for transplant patients as they're preparing, and then all the way through, as Sunny said before, as long as there is related expenses to my condition, which essentially will be for the rest of my life, I can continue to fundraise through Help Hope Live. So, for me, it was really good to have that head start, because, I did have a fairly serious surgery at the time that I was listed. But then knowing that you have $1 million surgery coming up and transplant at an undetermined date, it was important to fundraise immediately. And so once I figured that out, 6 months in, I got to work and got my fundraising campaign put together for Help Hope Live. And it's been a great experience ever since. And obviously, almost 3 years later, after I was listed, I did receive my heart transplant, and now I'm coming up on 5 years since my transplant this August.
I forgot that it was almost 5 years. That's phenomenal.
Yeah.
And so with that, as Pat and Diane both said, it is fairly easy to get started. And if you are interested in doing fundraising with Help Hope Live, and we hope you are, contact us. That is the best way. I always just say, have that first phone call before you say, no, I don't want to do that. It's very simple. You can contact us via our website or call our 800 number and speak with one of our client services coordinators. They'll have that first phone call with you, help you figure out who your community is, what might work best within your community, and if our program will truly work for you. At that point, they will send you out a welcome packet, which will include all of the terms of service for you to sign off on, all of those fundraising ideas we mentioned before, the medical verification form. And once we get all of that paperwork back, there is a $25 onboarding donation that can be made by anyone in your community to get your campaign page kickstarted on our website. And at that point, you are good to go. You're starting to fundraise with us. So this process truly can take 48 hours. It could take up to a week or two. It really just depends on getting everything back to us, but we try to make it as easy as possible for you. And with that, I really do want to say that I appreciate all of you being here today. I don't know, Carla, if we have any questions that have come in, that would be great to hear as well. I know I might have one or two follow-ups for Pat and Diane as well, so let me know.
Absolutely. Thank you so much to Diane, Pat, and Sunny for taking time out of their days to share Help Hope Live with us. And to answer your question, Sunny, yes, we are getting comments and feedback and questions from the audience. And to our audience, we will get to as many of those as possible before we wrap up. But again, if we don't get the chance to answer your question, we will follow up with you by email. I want to take just a moment to say, for those of you that regularly, and I hope that's a lot of you, participate in Needy Med's webinars, you know I'm quite chatty. Well, I will tell you, I was left almost speechless. That's because I am not only moved by Diane and Pat and their stories and resiliencies, and they're so inspirational, but also the level of detail that Sunny and her team has gone through to help Hope Live to make it easy to fundraise for people in communities that really require it. And some of the things that jumped out at me, and I can see by the comments and the feedback I'm getting that I am not alone by being blown away by this presentation. And the things that really just touched me as far as the Help Hope Live organization is the level of personal support and care. And it was very eye-opening because it never occurred to me how other fundraising platforms for the individual might have to be concerned about that being considered income. So the level of detail that Help Hope Live has covered is really quite something. And the numbers blew me away too. Raising $165 million in 4 years and processing.
I would say 40. I will say it's been 40, not 4 would be
40.
amazing.
Oh, I'm sorry. Did I say 4? No, I meant 40. I meant 40. Thank you. But $165 million in 40 years. That is an enormous amount of money. And the fact that you and your team can process those, you said in the last year it was 4,500 fund requests paid, and that you're looking to surpass that this year is quite phenomenal. And the two things, in addition to their personal stories and their inspiration that Pat and Diane were willing to share with us, the two things that really struck me is that they both drove home how important it is to get a head start. So I think if there's something on your mind and you're not quite sure and you don't know how to begin or if you should begin, as Sunny said, reach out, visit their website, make that phone call, and don't wait. And the other thing is, both Diane and Pat heard about Help Hope Live not directly. Diane through the Christopher Reeve Foundation, their packet, and Pat said, this was mentioned to me as an offhanded comment by the social worker. The reason that struck me is because to those that are joining us today, if this is not a solution for you, your loved ones, or patients and clients, don't forget that there's other people out there that are probably in desperate need. So simply chatting about it and spreading the word in any way you can is super important. So I don't want to take too much of anybody else's time. I do want to get to those questions that are coming in. And for those of you that may have forgotten, you can go ahead and submit questions by typing them into that question section of your GoToWebinar control panel. I also will remind everybody that Needy Meds is also here as a source of support if you're having trouble affording your day-to-day healthcare expenses. Check out that healthcare savings tab on needymeds.org or reach out to one of our expert call center counselors. The list you're looking at on your screen are all the different categories, ways to save on your healthcare expenses that you will find under that healthcare savings tab. If you'd like to learn more, again, browse that website, give us a call, or join us from one of our monthly overview webinars. And again, you can find those under the Education tab, but you can also find upcoming webinars on the calendar of events, which is on the right hand of our homepage. So as promised, I want to leave the contact information up for Help Hope Live and Needy Meds. And again, Help Hope Live is www.helphopelive.org, 1-800-642-8399. And Sunny did leave her own personal email address up there if you needed to email any questions. That's smullen@helphopelive.org. So let's get to those questions coming in. One of the first one was, and although you did go over this, it's a great opportunity to drive it home, because the question simply was, how does someone get started with Help Hope Live? And I'm going to go ahead and direct that question to you, Sunny.
Absolutely. And one thing based off of what Carla was just talking about that I also want to drive home is that no matter where you are in your medical journey, for really lack of a better term, unfortunately, we are here to help you fundraise. So whether you're newly diagnosed or you're years into your diagnosis, or you're newly injured or years into your injury, as long as you have medical expenses related to that condition, we're here to help you fundraise. And we are here for your lifetime of fundraising. So you don't have to be new to your diagnosis or your injury to start with us. And to get started with us, my email is up on the screen. You're more than welcome to reach out to me. You can call our 800 number and speak to a coordinator right away and have that first conversation, or go to our website. I encourage you to go to our website. We have a great FAQ section. We have a great blog section under our latest tab that really gives a lot of wonderful updates on our clients and client stories, and will give you a great feel for our community and how we help our community fundraise. So I encourage you to do all of your own research, check us out, and then have that conversation with the client services coordinator so that they can send you a welcome packet. You can see if we would work best for you. And it's simple, I promise. So it's pretty pain-free.
It really does sound pain-free. You guys have made it so easy to get started, and I love that you have a client services coordinator to make it even easier.
Absolutely.
Thank you. And thank you to our audience for the question. So we got another question coming in, and I'm going to direct this to either or both Pat and Diane. The question that came in was, what made you choose Help Hope Live?
I'll jump in here. You know, I mentioned that my social worker at Cleveland Clinic is the one that brought my attention to Help Hope Live, but really, you know, it was up to me to investigate that and another organization. And for me, it was pretty clear right from the get-go that this checked all the boxes for me. The personal attention was very, very important, and you know, it's been 7 years now since I started fundraising with Help Hope Live, and I still get that personal attention, you know, almost 5 years after my transplant. So that's number one. And then, you know, at the time that I began with Help Hope Live, I was on Social Security disability, and I was, you know, because of the way Help Hope Live is set up, my disability, you know, because I was limited in the amount of income that I could make, Help Hope Live checked that box as well. So I didn't have to worry about that being my money because of the way things are set up. You know, I heard horror stories of GoFundMe, and that's, I think, the first place that people think to go when they're in a crisis situation. But I've heard horror stories of people getting all kinds of money donated for whatever their situation is. But if they're on, if they're on government disability or something like that, that can affect their benefits because they have to report that as income. And I don't think most people realize that going in. So that's not an issue with Help Hope Live. So I think those are probably two of the main things that were most important for me when I chose Help Hope Live.
Thank you so much, Pat. And I will absolutely agree that until today's presentation, it never occurred to me that fundraising on a platform can be considered an income and then therefore can affect people's benefits. I am blown away by that. And now that I know it, it seems like something that should have always been so obvious to me, but I would bet that a lot of people listening in would agree that that's news to them as well.
Right. And
Thank you
it's
so
also
much.
taxable for it's taxable income too. So that's another wrinkle.
Oh, so yeah, they kick you twice when you're down. Right.
Right. Exactly.
Exactly.
Yeah,
So thank you. Thank you.
both of those also, I'll just jump in. As I said before, my parents kind of are the ones that got my campaign started for me. But as Pat mentioned, I think the taxable income aspect really sold my parents. But also, I think it was my dad originally who called and just built like a great relationship with whoever he talked to, and that really sold him, just like that personal connection and like having someone that is looking out for you and has your back. And he really like grew a connection just over the phone pretty immediately. And I think that really helped, just knowing that like someone cares and someone's looking out for you.
Absolutely, that would help. And there's clearly a theme, which is that is something that struck me throughout your presentation today. But as you and Pat both stressed, that was something that really made you decide that Help Hope Live was the organization for you, that level of personal attention. And the fact that Sunny has shared that if you have any questions, you don't know how to get started, whatever may pop into your mind, to it so encourages people to directly reach out to that client services coordinator. That is super important and very valuable. Since we're chatting with Pat and Diane now, I'm going to present you both with another question that came in, which is, what types of fundraisers have you guys done through the years?
And I also want to piggyback on that question just to see what types of expenses have you used those fundraisers to fundraise toward?
Oh, that's a good one.
So I'll jump in. I've done a couple of fundraisers. I think because I've only been injured 2 years now. I feel like in the first like year is when I got most of like support and money coming in on my campaign. Uh, and but my friends really took charge of setting up a lot of my fundraisers. And so I think just having like a really great support system and asking your friends for help, like, hey, can you just help me like set this fundraiser up, help promote it a little bit, really worked well for me. They did a like they called it miles for Vidi, because my Instagram handle name is Vidi's Voyage. So they did a Miles for Vidi little campaign, and then just shared that. And over a month, like each person ran 100 miles in I think 6 weeks. And each mile, someone could like sponsor essentially, but they really shared the my Help Hope Live campaign page through that. And that like got a lot of attention. I also took advantage of um, Giving Tuesday, and Help Hope Live created this social media uh, like design, and it had like Help Hope Live, Giving Tuesday, and my face in the middle. So I shared that on my platform, and on Giving Tuesday, Help Hope Live like decreased the administration fee. So I kind of highlighted that and used that as one of my fundraisers as well. And then to go off of how or like what I've used, my biggest expense, I mean, I've used a lot of transportation expenses, relocation expense, but I would say a big expense that I got recently was I bought a new car, and Help Uplift transferred all the funds. I didn't have to worry about that whatsoever. And again, like, I've been leaning on my parents a lot. So my parents were involved with talking to Help Hope Live and making sure everything was set up. And it was super easy, smooth process. And I got a new car. So I'm really excited about that.
Wow, you should be really excited about that. And it does sound like Help Hope Live was there for a number of crucial um, needs along the way. And it's really great to hear that you had a group of friends that were able to help make the most out of this Help Hope Live opportunity. And again, it just jumps out at me that Help Hope Live was able to be there and their support staff to be creative and create social media graphics and take advantage of things like Giving Tuesday. That's really something. And Pat, we'll give you an opportunity if you wanted to share as well types of fundraisers you've done through the years or any major expenses that you would say that Help Hope Live has helped you to cover.
Sure. Essentially, the vast majority of the fundraising that I did, and I'm very fortunate that I have a large community of people who support me and who supported me throughout, including, friends of friends, and, so I had, strangers contributing to my campaign. But so mostly it was just, kind of updating my campaign page and then posting it to Facebook or Twitter, just kind of give people an update and say, hey, still raising money. And I would say 80 to 90% of the money that was contributed to my campaign came before my transplant, which was good. When I actually got to transplant, I figured there would probably be an uptick in contributions, and there really wasn't that much. So it was good that I had built up quite a bit prior. So some of the things, with a transplant, you take transplant medications for the rest of your life, and they're very, very expensive. So that's one thing. Fortunately, they do fall into my insurance, out-of-pocket max, deductible, and all that kind of stuff. And frankly, when you're a transplant patient, your out-of-pocket max is what you're going to pay for the year, every year. I can't remember the last time I didn't hit it. It was certainly long before my transplant that I did not hit my out-of-pocket max for insurance. So there's that. It helped with. About a month before my transplant, I actually had a stroke that was caused by the heart pump that I have, and that led me to go to the hospital in Dayton, where there is not a transplant center. There is not an LVAD center in Dayton, Ohio. So they didn't really know, the doctors didn't really know quite how to handle my situation, because in all likelihood, it was the heart pump that caused the stroke, which, it's I wouldn't say fairly common, but it's definitely something that they worry about with heart pumps. So anyway, so the doctors there decided that I had to, that they couldn't care for me, so they sent me on a helicopter ride to the Cleveland Clinic, which after about a year and a half, my wife fighting with the insurance company, they still insisted they were not going to pay for it. And so we were at the mercy of the helicopter company to work with us in terms of paying for this, and how much were they going to make us pay. And we got it down to a much more manageable number, because it was about $50,000 to begin with. But anyway, Help Hope Live covered that humongous expense, which would have basically wiped out any savings that we had, and then some, or probably put us into bankruptcy. So that would be one of the definitely major things that Help Hope Live really came to the rescue for me.
Wow, that's another unbelievable story. And thank you so much to Pat and Diane for being so candid and transparent about what has happened in your lives and your experience with Help Hope Live. We did have a question coming in, and I think I'm going to go ahead and make this the last question for this presentation. But again, to those joining us today, if you did submit a question that we didn't get a chance to answer, we will follow up with you by email, but don't hesitate to reach out to either Hope Help Live or Needy Meds at the contact information on your screen. So I thought this, Sunny, question that is I'm going to direct it to you, was a great way really to wrap up today's presentation. This is something that was addressed in the beginning and sort of throughout the presentation, but if you can drive home the answer to this question, which is what makes Help Hope Live different from other fundraising platforms?
Absolutely. And it is so important because this is truly what draws, as you just heard from both Pat and Diane, what draws our clients to us and what keeps them with us. So the three main advantages to coming to work with Help Hope Live are, first and foremost, the personal support we're able to offer, from our client services coordinators to our finance team to truly anyone on our staff that you get on the phone, that you get through email. We are all equipped to help you with your needs and to help point you in the right direction. So that is something you truly just won't find anywhere else, that you will get a person on the line. We do now have staff all across the country and our brand ambassadors all across the country. So we are equipped to really help anyone and everyone with their needs in that personal manner. Secondly, we are a nonprofit, so all donations are tax deductible to the fullest extent of the law. And anyone donating, if their employer happens to have a matching gift program, they can sometimes double or even triple the effect of that donation, which is so important. And our clients are also eligible to get donations from major corporations that can donate toward a nonprofit instead of going toward an individual, which is really important. And we see that happen quite a bit. And last but absolutely not least, because it really supports everything we do, is the way that we manage the funds. You are donating toward Help Hope Live in honor of the individual, and all of the funds are being managed by Help Hope Live in regionally restricted funds, depending on where the individual lives. And that is where they then submit their bills to us, and we pay out of those regional funds. And where this comes into play is that we are here to manage those funds and to help you pay for your bills for your lifetime. As long as you have medical expenses related to your condition, we are here for those. If you choose to close your campaign, or if you unfortunately pass away long into your lifetime, if there are any bills outstanding, we help with those. We help with some basic funeral expenses. If there are any funds remaining at that point toward your campaign in that regional fund, they then go to help other individuals living within the region, so that we are paying it forward as a nonprofit, always helping the greater good. And most of our clients, all of our clients, are happy to hear that. They are helping as many people as possible with the funds that are being raised in their honor. So while you are with us, while you are fundraising with us, we are here to honor your donor's intent with those donations. But long after that, we're able to help everyone else as well, and truly keep our clients living their lives as fully as possible. So I really appreciate all that you're able to do with us today, Carla and Needy Meds, and thank you again to Pat and Diane for joining us. I will turn it back over to you, Carla, but I really appreciate you giving us the time today to help share Help Hope Live's mission.
Sunny, thank you so much, and thank you to our audience member for that question, because I feel like it was the perfect wrap up to today's presentation. So a big thank you right back at you, Sunny, Pat, and Diane, for this super informative and super inspirational presentation. And of course, thank you to Needy Meds users and friends for taking time out of their day to join us and learn about our partner, Help Hope Live. We do hope to see your names pop up in future webinars. And please, we encourage you, visit hopehelplive.org, follow them on social media, reach out to them if you, a loved one, a patient, or a client may be interested in the assistance they have to offer. And don't forget to mention it throughout your day. Post about them on social media, because as Diane and Pat shared, you never know whose life you can change by simply sharing Help Hope Live with someone. Thank you so much, everyone, and have a fantastic rest of the day. Bye.